This segment of the news is brought to you by Sun Oil Limited.
Welcome back. A unilateral decision by health officials requiring all supervisors to roster all health care and support staff on a shift system in support of social distancing to assist in the collective fight and management of the COVID-19 crisis is believed to be unnecessary by Bahamas Doctors Union President Dr. Millicent Bassett. Responding to the notice dated August 11th and signed by the Ministry of Health's Acting Permanent Secretary Pernell King Rule, Dr. Bassett says this.
I think all unions, especially mine, we've been of the opinion that those with premorbid conditions that have been listed numerous times should not be on the front lines and should not be rostered to work. Certainly, that should include pregnant females as well. And certainly our concern for safety would extend to anybody who does not have the appropriate level of PPEs for the level of contact that they're exposed to. So if they don't have the PPEs, then we don't see the legal backing to force a person to work. So that's certainly a concern.
Dr. Bassett adds that the union doesn't think it's necessary because there are additional physicians in the country that can help augment the staff. In fact, she says they're waiting to be hired.
We have also, in the past, why there wasn't an order to force persons to work was because that we were able to come together and create a volunteer list. South Beach Clinic was staffed by volunteer physicians and volunteer nurses. So this hardline approach, I don't think is necessary. And even now, we're in the process of communicating with other areas that are being hard hit. And this is the three medical unions. We just had a meeting yesterday, and we're in the process of asking our members to volunteer if there is a shortfall.
Dr. Bassett assures that her members do take the health of Bahamians very seriously and assures that they will not compromise. Meantime, the Public Hospitals Authority confirming that there has been an increasing number of cases of COVID-19 across our healthcare facilities in New Providence and Grand Bahama, and the PHA is acting to minimize the growing risks of COVID-19 exposure to staff and patients. Just yesterday, the PHA announced that its corporate office is closed until 9 a.m. Monday, August 17th, as it undergoes deep cleaning and sanitizing following a staff member testing positive for the virus. PHA in a statement today says the occurrence of an increasing number of cases of COVID-19 across healthcare facilities is consistent with COVID-19 spread worldwide in hospitals, as there is a higher rate of infection among emergency room doctors and nurses, given that they are the first point of contact for patients suspected of being COVID-19 positive. In the Bahamas, the assessment, testing, and investigation protocols for staff implemented by the PHA is being guided by the approved policy of the World Health Organization and in line with the national policy under the Ministry of Health. Some of the measures that have been implemented to protect staff and patients include providing for an increased and consistent stock of personal protective equipment to staff across all of its facilities, increasing the frequency with which the hospital is sanitized, and rerouting of general hospital traffic in order to maintain distancing between non-COVID-19 patients and those suspected of being positive for the virus. Additionally, the PHA has improved its bed capacity at the Princess Margaret Hospital through the transfer of boarders to accommodations in line with their needs and has secured a private facility off-site for quarantining and treating suspected COVID-19 cases. This approach effectively minimizes the potential for spread of the virus among non-COVID-19 patients and staff within the Princess Margaret Hospital. The statement continues that the health and safety of all patients and staff of PHA continues to be their priority. As the situation continues to evolve, the PHA will continue to implement protocols to minimize patient and staff exposure across its institutions and agencies. The public is strongly urged to pay attention to all public health announcements, public service announcements, and updates regarding health and hospital services during this time. Our final story is up next.
This segment of the news has been brought to you by Sun Oil Limited.